It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. What is the most frequent disease in dogs? The goal of this video is to share with you some of the most common diseases found in dogs. We will also go a little deeper into what symptoms and signs we should watch for. Let's start with the most common. 1. Canine influenza, canine flu. Canine influenza is transmitted through aerosols and fomites, i.e. playing, biting, chewing on the same toys as a dog carrying the virus. The clinical signs in your pet are the following: cough, lethargy, anorexia, fever. There is no specific treatment for canine influenza, but there are ways to treat the symptoms. Fortunately, there is a vaccine that helps in the prevention and severity of this virus. If your pet has canine influenza, symptoms begin within 2 to 4 days and they are considered contagious for at least 7 days. The best thing you can do is isolate your pet. 2. Canine parvovirus. This is one of the most terrifying and well-known diseases. It is a deadly virus if new puppies and unvaccinated pets are not cared for properly. Parvovirus is transmitted through oronasal exposure with infected feces. It is a very resistant virus and can live in the environment for many months or years. If a pet licks unknown feces while walking or playing with a toy that previously had infected feces. Once infected, symptoms will develop rapidly and may include any of the following: bloody diarrhea, most common, vomiting, anorexia, fever, lethargy, and/or depression. The best way to prevent your pet from contracting this deadly disease is through vaccination and isolation. Vaccinations can begin in puppies from 6 weeks of age to approximately 16 weeks of age. 3. Kennel cough. It is more accurately described as canine infectious respiratory disease. They can cause similar symptoms of coughing, tracheal tenderness, lethargy, and sneezing. Some of the viruses and bacteria covered under this name include canine distemper, canine parainfluenza, canine herpes virus, and Bordetella bronchoseptica. It is another contagious disease that is contracted by oronasal exposure to aerosolized respiratory secretions. It is similar to the canine influenza virus in that it is commonly transmitted in densely populated areas, such as dog parks, boarding schools, shelters, dog daycares, and grooming facilities. This is one of the most common respiratory diseases that dogs can contract throughout their lives. It is seen all year round, but is more common during the winter months. Antibiotics are usually not needed for treatment. Clinical signs are usually mild and disappear on their own within 10 days. 4. Reverse sneeze. You know when your dog makes that loud honking/snorting sound and you don't know if it's coming from his throat or his nose? That's a reverse sneeze. In more medical terms, a reverse sneeze is an irritation to the soft palate and throat that causes a spasm. This spasm is known as a reverse sneeze. This phenomenon sounds scary when you hear your pup do it for the first time, but it is usually benign and does not require any treatment. Common causes of this can be anything from excitement, pulling on a leash, to pollen, allergens, perfumes, etc. As soon as the irritant has left the system, the reverse sneeze will resolve itself. 5. External parasites, skin. Fleas are the main cause of allergic dermatitis in most dogs and cats. The cause of the allergy is usually due to a reaction to a flea's saliva, so when it bites our pets, they begin to itch and become irritated. Fleas can also harbor intestinal parasites, mainly tapeworms, which can cause diarrhea and/or vomiting. Next are ticks. Ticks can latch on and begin sucking blood from our pets and us and transmit a variety of infections while doing so, including but not limited to Lyme disease, ehrlichiosis, and anaplasmosis. 6. Heartworm disease. Heartworms can sometimes be a little tricky, but they are a very devastating disease if contracted. It can cause a healthy puppy to suddenly have a lifetime of heart disease and chronic coughs. Heartworms are transmitted through a mosquito bite and take about 6 months to be accurately diagnosed. If your pet does not take a regular heartworm preventative, the larva can easily move on to the next stage of its life that can no longer be eliminated by the preventative. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.